Please, listen to me. I'm sick. Why won't anybody listen to me? It isn't all in my head. Please help me. Somebody, please help me. This is the cry of people caught up in the condition called hypothyroidism, which is low output of thyroid hormone. This in turn affects the energy level and the metabolism in every single cell of the body. These people remain undiagnosed sufferers, sometimes for decades, and it has become a neglected condition. Their cry is falling on deaf ears. My name is Diana Simone, previously Holmes, author of Tears Behind Closed Doors. The misinterpretation of thyroid function test results is the biggest faux pas in medical history. I am in my 21st year of campaigning for a change in clinical practice regarding the interpretation of thyroid blood test results for hypothyroidism. For decades, they have been misinterpreted. I am not stating and have not stated that those who measure the value of thyroid hormone in the blood are at fault. The biochemists have sophisticated methods of measuring the value of thyroid hormone in the blood. What I am stating is that when the blood test result is returned to the surgery, it is misinterpreted. At this juncture, I have to say straight away that I do not believe that this is the fault of the GPs. This has not come about by GPs' neglect of the patient. There appears to be a very strict ruling from the endocrinologists. If the GPs were to treat patients when their blood test results lie within the reference range, together with many signs and symptoms of hypothyroidism, then it is quite likely that GPs would be hauled off to the General Medical Council, and nobody wants to lose their job. Many private GPs outside of the NHS have been taken before the GMC for treating patients inside the reference range, and the way that these GPs have been treated is absolutely appalling, bearing in mind that the patients have returned to good health. It would appear that if you diagnose correctly, you will be brought up before the General Medical Council. What about all the misdiagnoses? Are they to stay under wraps? GPs are told that it is dangerous to give thyroxine as it could produce heart and bone problems. And yes, I agree. It would be if the presented picture of the patient did not warrant it, or if the patient is overdosed with thyroxine. But the medical profession omit to tell you that if you do not have enough thyroxine in your blood, then it is dangerous because it could produce a heart condition and much more. There is one particular area in medicine that all doctors should be aware of, and that is the individuality of the patient. And that is why there is a reference range in the first instance. If we were all the same, there would be no need for a range. Another thing, the GPs do not have a baseline to work from, so how do they know where each one of us should be in the reference range? Over 20 years ago, I started to research and found the flaw. The medical profession are using the blood test results for thyroid function to be the sole determining factor for diagnosis. The reference range was only ever meant as a guideline, and therefore misinterpretation of thyroid function test results has come about. The misinterpretation has resulted in hundreds of thousands of people in the UK and millions worldwide suffering with hypothyroidism, undiagnosed. Some have been ill for decades. And nobody knows the true count of hypothyroid sufferers because of misinterpretation. In 1994, I sent a report to the World Health Organization stating my concerns. They replied and stated that they were going to remove the word normal and introduce reference interval. 20 years later, the word normal is still used today. I titled this video for YouTube, "The Misinterpretation of Thyroid Function Test Results is the Biggest Faux Pas in Medical History," because I had stated this nearly 17 years ago in my first book, Tears Behind Closed Doors. This travesty of justice for patients is still in the same place it was all those years ago. 7 years ago, I was on a morning television programme and was going to tell everybody about the misinterpretation of thyroid function test results. But someone prevented me from doing so 2 minutes before I went on air. I was absolutely crushed. 14 years' work gone. I am very sure that the two main presenters had nothing to do with this. Nobody can stop me now. I will tell of what I know to be true. I want at this stage to introduce how the reference range is made up. Now bear with me, it might sound scientific, but I will explain. It is made up of 95% fiducial limits of so-called healthy people. This means an assumed fixed basis of comparison of so-called healthy people. Either end, it's loose. So surely there must be flexibility upon interpretation. There is none. Interpretation is completely rigid. Because of misinterpretation of thyroid blood test results, patients have been pigeonholed into other conditions, for example, ME, chronic fatigue, fibromyalgia, depression, postnatal depression, to name but a few. Now, millions of pounds are spent each year on postnatal depression alone. And also, postnatal depression does not last for years and years. If the condition has lasted for more than 12 months, then the patient's thyroid hormones should be checked, together with any signs and symptoms of hypothyroidism, but certainly not by the current clinical practice. By using the thyroid blood test results to be the sole determining factor for diagnosis, signs and symptoms are ignored. But in no way am I stating that all depression is hypothyroidism. Hypothyroidism has its own depression. Endocrinologists insist that many of the signs and symptoms are non-specific and could relate to another condition. I agree with this also, and as long as other conditions have been ruled out, when a GP has the thyroid blood test results in front of him, with a T4 in the lower range and a raised TSH, together with many signs and symptoms of hypothyroidism, why pigeonhole the patient into another condition? Thyroid blood tests alone do not give the GP the full presentation of the patient. If the evidence is blatantly obvious, then what about patient choice? Prime Minister David Cameron talks about the European Union as having a one-size-fits-all approach. This could also refer to the medical profession. If your result lies inside the reference range, then according to the medical profession, you do not have a thyroid condition, and it doesn't seem to matter how many signs or symptoms of hypothyroidism you are manifesting. The British Thyroid Association, that is a group of endocrinologists, state on their website 2014 that currently, quote, currently, the BTA does not hold the view that treatment for thyroid disease, either underactive or overactive, should be commenced if patients' thyroid function test results lie within the normal laboratory range. There is no mention of signs and symptoms. Where do the GPs stand in all of this? Precisely nowhere. I know that there are some in the medical profession who agree with these findings, so I'm asking you in the UK to come out from behind closed doors to support these patients, who more often than not are told it's all in the mind. And if they manage to find a private GP who tells them that they do have a thyroid problem, and they are treated and their good health returns, then the medical profession say it's a placebo effect. The majority of these patients do not want to be ill. Now let's go through some signs and symptoms of hypothyroidism. Are you tired all the time? When walking, does it feel as if you are walking through treacle? Have you put weight on, but your diet hasn't changed? Are you lacking motivation? Are you feeling depressed? Is your memory failing? Is your concentration not as good as it was? And have your thinking processes slowed down? The outer third of the eyebrows is typical of hypothyroidism, underarm hair loss or pubic hair loss, or pubic hair loss. Dry and flaky skin, skin that feels like leather. Skin conditions, for example, eczema. Do you have sleepless nights? High blood pressure or low blood pressure? Panic attacks? Have you started to feel the cold all the time when others don't? Migraines or headaches? Digestive disorders or constipation? Menstrual disorders? Do you suffer from anxiety? Are you stressed? These are only a few of the signs and symptoms of hypothyroidism. The reason why there are so many is because the thyroid hormone is responsible, as I said before, for the energy and the metabolism of every single cell in the body. Is it any wonder that the signs and symptoms are so diverse and that there are so many? One week, the patient can tell the GP certain signs and symptoms that have manifested, and another week there will be another set of signs and symptoms that have manifested. This really is happening to the patient. GPs struggle with demand in the surgery. If this situation was corrected, then demand in one area would fall away dramatically. There are two presentations of hypothyroidism. One, the patient is overweight and puffy. The other is that the patient is thin and looks worn out. Signs and symptoms of hypothyroidism overlap with signs and symptoms of hyperthyroidism, which is an overactive thyroid. I suffered with all the signs and symptoms I have just mentioned and more over a period of 40 years. I had polio at the age of 11. For 23 years I was misdiagnosed 6 times with serious diseases: epilepsy, celiac disease, allergy to gluten, depression, polymyalgia rheumatica, which is a muscle disease, ME, and finally I was treated for 3 years for myasthenia gravis. This is a very grave, progressive muscle disease. I was diagnosed correctly in 1994 by a private GP, After treatment with medication, my concentration came back, I could walk again, and I dispensed with my wheelchair. My skin was no longer dry, I lost weight, and I was laughing again. I was alive instead of feeling I just existed. The panic attacks had left me. My skin had a healthy glow, and I have never looked back. My thyroid function test results before I was correctly diagnosed were TSH, which is thyroid stimulating hormone, was 1.95 in a reference range of 0.45 to 4. T4, which is thyroxine, was 17 in a reference range of 11.5 to 23. I was just under the halfway mark, and yet I was hypothyroid. For those who have suffered for decades, you may have a hard time knowing when it started. It can sometimes be caused by shock, which covers so many areas. Post-traumatic shock is one area. Accident, bereavement, operation, birth, stress over a long period, or a viral illness are also other triggers. If you have been diagnosed with hypothyroidism, how many years were you ill before you were finally diagnosed? In 1 year, 10 million thyroid blood tests are carried out. Some, of course, will be repeats. There will be many of those who will be told that they do not have a thyroid condition. How many of you have been told that your thyroid function test is in the normal range, and then you are requested to return in 12 months or sooner for a repeat blood test? Meanwhile, you are still suffering. So you return in 12 months and the result is the same, but you are still poorly. Some of you have many signs and symptoms of a low thyroid condition, but if a normal blood test result is returned, you can either be told that you do not have a thyroid condition or you are borderline. Now, you could be borderline for years. So do you have to fit in with the blood test result, as I stated in my first book nearly 17 years ago? There is no such thing as borderline. You are either hypothyroid or you are not hypothyroid. Or you could be treated singly for each sign and symptom. How costly is this to the NHS? Or, of course, you could be pigeonholed into other conditions, as I mentioned previously. The current practice of interpreting thyroid function test results has been draining the NHS for decades. There are other things that should be taken into consideration when making a diagnosis of hypothyroidism, such as signs and symptoms. For example, signs: temperature, pulse, blood pressure, looking at the state of the skin, nails, hair, and tongue. If you have a thick tongue that feels too big for your mouth, it could be a sign of hypothyroidism. And then, of course, symptoms, how the patient feels. All of these should be looked at and taken into consideration together with the blood test result when making a diagnosis. The blood test result should not be used as a sole determining factor for diagnosis, and I cannot stress this enough. There is a condition called thyroiditis, and this is inflammation of the thyroid gland, but that should have been ruled out by an endocrinologist. I started up my helpline in 1994 and interviewed and counselled thousands of people to help them become informed in order that they could make an informed decision. In 1996, Dr. Gordon Skinner, lecturer at Birmingham University Medical School, had heard about my work, which had started in 1994, and someone on my helpline told me that he would like to meet up with me. I met with Dr. Skinner and showed him my research. He agreed with my findings and asked me would I set up clinics because he knew I'd had nursing training. We saw thousands of patients return to good health. Very sadly, Dr. Gordon Skinner passed away in 2013. Dr. Skinner worked tirelessly for these patients and is very sadly missed. My reason for putting this onto YouTube is to reach the world, because enough is enough. To those who have returned to good health, together with your family and friends who have seen the change in you, and for those who have been told, because their thyroid function test result is in the normal range, that they don't have a thyroid condition, but you are still not convinced, to all of you, I say, this is your chance to really move this forward. And I probably will repeat myself again, but remember this. This could affect your children and your grandchildren through your DNA. How can you help is at the end of this video, and you will need a pen and paper. This has been bubbling under the surface for such a long time. So once and for all, let's get this problem aired and sorted. But you are needed to put pressure on the medical profession. It is numbers that will do it. I took my presentation down to London before members of Parliament in 2007. At the end of the meeting, I was told to raise funds so that a placebo-controlled trial could be performed. This does not need a placebo-controlled trial. The reference ranges were never trialled in the first place when it was introduced into practice in the 1970s, so why the necessity now? It is the clinical practice of interpretation that is in question, not the medication. If the medical profession were to carry out a placebo-controlled trial on the clinical practice of interpretation, it would cost the NHS millions, which they don't have. And from start to finish, it could possibly take about 4 years to completion. Is it fair to ask these patients to wait another 4 years? The NHS is at breaking point with an £8 billion shortfall each year. Looking at it from the financial point of view, if the GPs send patients for x-rays, scans, MRIs to specialists, or give patients numerous drugs for the signs and symptoms they are suffering, then the saving for the NHS could be billions. But best of all would be the patient's return to good health. There is culpability, and it lies with the medical profession. Dialogue is desperately needed. Specialists in this field have had invitations extended to them by Dr. Gordon Skinner, but they refused outright. My initial plan is for enthusiastic medical investigative journalists to come forward to speak with me, but who will not be fobbed off by the medical profession. I will email newspapers and TV news desks individually. Also for doctors in the UK to join me and challenge the medical profession in the UK and put pressure on them to take part in sensible dialogue with those who are willing to discuss the flaws in the interpretation of thyroid function test results. I have evidence and references and also emails from one of the developers of the reference range that back up my campaign. So journalists and doctors are needed to give these findings a fair hearing. I have not undertaken to do this without a sense of responsibility. Once talks are in place and the outcome is favourable, I have a set of proposals that I would like to discuss. These proposals can be put into practice fairly quickly with the minimum cost to the NHS. I have taken this campaign everywhere, and at each turn I have been blocked by the medical profession. Some patients are so desperate that they are now turning to the internet to be treated for their thyroid problems, when in effect they should be treated by the NHS. The majority of these patients are not monitored, and that, for me, is really concerning. Now we're up to what you can do. I am now on Facebook as Diana Simone, Thyroid Lady in brackets. So that's what you put in, Diana Simone, Thyroid Lady. In the days when I was doing clinics, the patients affectionately called me the Thyroid Lady, so I thought it was very apt to add it on to my Facebook name. Now, number 1, I have set up a government e-petition titled "Demand that thyroid function test results are interpreted correctly." By the way, note the spelling mistake before you all come to me. The link is on my Facebook. If you agree with this, then please sign. Number 2, if you agree with this video, then please target newspapers and news desks. If we keep the media to a limit, then the numbers won't be spread out too thinly. My suggestion is the Independent, Daily Mail and Telegraph for the newspapers, and the news desks, BBC News, ITV News, Sky News and Channel 4 News. These links will also be on my Facebook. This then will be a 3-pronged initiative. YouTube is my part, the e-petition and targeting newspapers and news desks is your part. But all of these things have to be done. The signing of the e-petition and the targeting of all 3 newspapers and all 4 news desks is imperative for this to work. Number 3, I will need a publisher to print the 3rd edition of my book, Tears Behind Closed Doors, as I am a pensioner now and I can no longer afford to print this again. The book will give help to people to become informed, and they can make informed decisions. When attending the GP surgery, they can help their doctor to help themselves. It will also give comfort and hope until the misinterpretation of thyroid function test results is resolved. I will also need help funding this campaign for stationery, or if I have to attend meetings, etc. But I am not asking for money for nothing. I do have something to sell. This picture of a lion, which I have recently completed, is on eBay, and there is a reserve price of £500. Some of you may know David Shepherd, the wildlife artist. It was David who actually encouraged me to keep painting. This money will help me to carry on my campaigning. So this is the picture. Okay. This really is your chance to do something about this. Regarding this YouTube, get in touch with your Facebook, email addresses, Twitter accounts, mobile numbers, and get people to sign the e-petition and target the newspapers and the news desks. Let this go viral, because if you don't do anything now, it could take decades for this to come to light, if at all. It has taken 20 years now. One very distressing situation has come to light. If you look at a back issue of the Daily Mail, Tuesday, November the 4th, on the health page an article by Jerome Byrne titled "A Cure for Thyroid Problems the NHS Ignores, or Quack Doctors Poison." I'll tell you a little bit about the story. An 8-year-old little girl became ill. She was exhausted. Her concentration had gone, and she had many more signs and symptoms. Her mother took her to doctors over the years, but nobody seemed to know what was wrong. In desperation, she went onto the internet. She found a qualified doctor in Brussels who not only diagnosed her daughter with a thyroid problem, but with other hormonal deficiencies. She became well. But within a year, the social services took the daughter away from her mother. The mother was arrested for cruelty to her child. I will let you read the whole story in the Daily Mail. This is yet another reason why we must be proactive for patients with undiagnosed hypothyroidism. And finally, to end on a lighter note, something that has amused me for many, many years and still does. Many in the medical profession have called me that woman. Well, I have to tell the medical profession in all sincerity that that woman is not going away. God bless you all.